is Wednesday. If you guys have been following along with my channel, I've been telling you guys a little bit about the WLS weight loss surgery complication I've been experiencing. So taking it back to the last video, we found that I have an ulcer or perforation in my accessory stomach. Because I had the gastric bypass, I have 2 stomachs, and now I'm kind of having some complications. So I am going through the process of getting it figured out. That way I'm not spending every single day popping Tums and ginger ale and ginger tea and Tylenol and anything and everything to alleviate that pain. So we are officially about to head out from Arizona to California. That's where my weight loss surgery surgeon is, Dr. Billy. He's in Ventura. He's amazing. I've had to wait a couple weeks, like 2 weeks, in order to see him. So finally that's happening. So we are just this much closer to getting some answers. Chugga lugga choo choo.
So we are currently in a sandstorm right now.
Wow.
We're going about 20 miles an hour. You can kind of see it. You can see it now. It's a little bit better, but we couldn't even see in front of the car at one point. We almost pulled over. We should have pulled over.
We are here outside of Dr. Billy's office. This is where I had my weight loss surgery. Dr. Billy is my surgeon. Yes, Billy is his last name. His name is Dr. Helmuth Billy. He's amazing, has a wonderful reputation. So that's where I'm at right now. Today is the day I'm gonna go in for my appointment. Well, actually, I just got out of the appointment. This is the one appointment I have made so far to kind of address the WLS complication I've been dealing with. What I just found out today with my surgeon was this is my first time seeing him since we did my gastroendoscopy, where we put the camera down my throat just to see if there was indeed an ulcer in there. We took pictures, he saw it, and then from there he prescribed me omeprazole to help the acid production in my stomach. So what I found out today was he pulled up my file and he was like, oh yeah, we haven't talked about this ulcer since 2020. And then he was like, okay, and then we gave you the omeprazole to help with the acid production, and then it looks like that ulcer was cratered with flappy material, and it was really bad. He said it was really bad, cratering, flappy material, and I didn't know any of the characteristics about my ulcer until today. And he was like, yeah, that was supposed to be something that we followed up with. We were supposed to just kind of take the omeprazole and then figure out our next step. Like if that really helped cure the pain, then fine, we'll take the omeprazole, but if it doesn't, we're gonna have to remove it. So finally, I'm basically doing a 2-year follow-up appointment for my gastroendoscopy, and what we are now kind of starting over the process. Dr. Billy wants me to sign up for a new gastroendoscopy so we can take new pictures, see if it's gotten any bigger, if it's changed at all. So he is ordering the gastroendoscopy. We're gonna get the camera down the throat. I'm starting the omeprazole again just to help with the acid formation in my stomach and the acid production, because that's what's causing a lot of the pain going from my stomach to my back. And then he also prescribed me the sucralfate, which is what I've already been taking thanks to Dr. Russo. Thank you so much, it's been helpful. So those are the 3 things that we're doing right now. But I will say this, a lot of this could have been prevented if I wasn't just kind of dealing with the pain. You know what I mean? Like most people, when they're dealing with this much pain, they go to the doctors, they go to the ER or the urgent care, and they like ask for help. I have just not been putting my health first, and I just stay busy, stay going. If I'm in pain, I can't let pain get in the way of my busy schedule. Take a Tylenol, take a Tums, take some more ginger ale, anything to help with this pain. So I don't want to keep scaring people from weight loss surgery, because that's not what I want this to be about. I just want to show you guys like the real struggles that can come with it. These are real complications that can come with it. And even though a lot of people think I'm the star student WLS patient, I try to be, trust me, but it's not perfect, and there's still going to be a risk no matter what. So basically my doctor, he says that he's really stoked with how far I've come and everything, but yeah, I've got an ulcer and he wants to probably cut it out. So we talked a lot today about, after that gastroendoscopy, he talked about the procedures that we could probably take, and he probably wants to cut it out. So he pretty much told me that there are 3 options: to deal with the pain, cut it out, or the third one was, what was the third one? He was like, deal with the pain, cut it out, or reverse the gastric bypass, and then I wouldn't have a weight loss surgery anymore. And he was like, that's not what I'm recommending. And I was like, we are not taking away my weight loss surgery. That's not happening. Not happening. We're gonna cut out the ulcer. I'm just gonna keep trucking along here. I also forgot to tell you guys that one of the things that Dr. Billy told me inside was that my ulcer could have been caused by stress, which is just insane because what have I been telling you guys? For the last 5 months, I have been dealing with like insane amounts of stress, like the most stress and anxiety I've ever experienced in my life. And it makes sense that now all of a sudden, like I've been able to deal with the pain like day to day, but the last like month, especially since I've been trying to like get these tests done and get off the medicine, I have been in so much pain, and this pain has been so much worse, and it just makes perfect sense because of course it's going to be worse while I'm under all this stress. I'm just so glad that I'm finally tackling this stress. As of this week, I started the anti-anxiety medication, and I'm also going to be starting therapy. So going to be starting to try to tackle the things with stress to help with that. But it's just insane that stress can really do so much to your body, physically, mentally, emotionally. Like it really can take a toll. I am walking proof of that. And if I would have just made the decision, the responsible decision to put my health first sooner, it probably wouldn't have gotten this bad. So if it gives anyone watching this a little bit of peace, if you're like shaking in your boots because you're so scared, what if this happens to me? Just don't wait around like I did. Like honestly, I'm taking this as a whole learning experience, humbly telling you guys, I was not being smart and I was not putting my health first. I was putting my health first in other ways, like while I was on competition prep, hitting the gym as hard as I could, tracking my macros. Oh my gosh, A+ material. But as far as this, I was not putting my health first. I was choosing which areas of my health I wanted to put first. I put this on the back burner. It's time to put it on the front burner and get some answers. One of the procedures that he was saying that we could maybe look into doing is cut away the ulcer, but also he mentioned snipping the nerves that connect from my head to my stomach because those nerves help produce the acid in your stomach, and it just like produces more acid. Your stomach was already producing acid, and these nerves just kind of help produce even more acid, and it will produce more acid in those nerves, especially when you're stressed. So if I'm stressed, producing all this stomach acid, that's what's causing all this crazy amount of pain. And it really freaks me out, like the idea of like slicing nerves that help produce acid to break down the food in my stomach. That kind of freaks me out. I don't like the idea of thinking about that. I'm gonna read up on it. I will read up on it just so I could get a little bit more comfortable, like knowing like what that procedure really entails. But that's the update so far. So looks like I'm going to be going in for a gastroendoscopy. I will be getting a call anytime from someone in here to get that scheduled. I'll have to come back to California for that. So I'll get the gastroendoscopy. I got to get new blood work done for him because the other one was for a different doctor. So more blood work. And then tomorrow is my ultrasound. I got a sooner appointment. Thank God. So we are getting answers, you guys, and I'm feeling a lot better today. Thank God. The car ride was a little rough. I cried a couple times from being in so much pain, but I tried to sleep most of it. But as of right now, in this moment, I'm feeling okay, and I am just so grateful. Thank you guys so much for just following along with this chapter of my journey. I am hoping to get some answers for us. Thank you guys so much, and I'll see you in the next video.